right, everyone. Welcome in today. It's another Financial Fridays with Sanies and Equitable, and today's topic is healthcare in retirement. Now, and Sanies is excited to offer these sessions in cooperation with our corporate partner, Equitable Advisors. And joining us today is Jim Pashalidis. Thanks for being here, Jim. And just a reminder, everyone, this session is being recorded and we will save questions until the end of the presentation, but feel free to add questions to the chat at any time. Our Q&A time is best used for general questions, but please know that anyone at Equitable is available at any time to answer your personal questions, and you can find contact information for regional reps at sanies.org. And I will turn it over to you, Jim.
All right. Thank you very much for having me today. I have shared the screen. If you could just give me a thumbs up, Paul, that the screen, everything's good. All right, great. Welcome, everyone. Taking time from a, I'm sure, busy day and on your lunch break. So we're going to try and make this very informative and useful for you in a nugget that you can walk away with some knowledge. So we're going to discuss a little bit of New York State of Health and Medicare 101. And here's a quick first slide. Write down any information about me that you'd like. There's a phone number and email, my company's website. I'm with Empower Agency, LLC. There's a QR code if you're savvy and you'd like to do it that way. And that's where you would probably bring any of your more personal questions. This setting today, as Paul referenced, is more for general understanding. I'll also let you know a little bit about me. I am actually a 20-year I resigned from educating and being a teacher in the Rochester City School District after 20 years. So I might know some of you on this call actually as administrators. And how Medicare came to me was during the ending part of my tenure as a teacher. My parents got divorced and I became the caregiver of my father, trying to figure out this world of Medicare. And during that process, I needed to get some help with that. And it was a daunting and almost overwhelming task. And even with a master's degree, I was spinning. So I saw a need and I thought, I think this is a new category, a new group of folks that I can still use my gifts of education to help empower people to make good decisions. So that's how I got here. And you may relate to that. And so my goal for today, as far as the purpose of today's meeting, is that one, you're going to get some information. You are not going to be an expert on any of this. If you are, I will hire you when you're retired and you can join our team. But you're going to get a surface and general understanding of Medicare. And if you're under the age of 65, you will have a potentially gap years of where you'll need some coverage until aging into Medicare. And that's where we'll discuss the New York State of Health for those of us who are New York State residents. So who I am, I've already told you a lot about this aspect. We help people avoid some of these categories on the right. We tell us spam calls. What doctors didn't you have? Can I get Medicaid? All of these questions come to me and more. And that's what I do, is I help people compare what's available in their areas. So who I help, New York State of Health is the marketplace, ACA, where individuals and families can get insurance. If they're not able to get it through an employer coverage, this is where they can go. We'll touch on that. Those turning 65 or older than 65, but losing their employer coverage because they work beyond 65, those are the Medicare side of things. Unsure if they want to stay on employer insurance or enroll in Medicare, if they have that option. And those who are unhappy with their current coverage, and even those who are on Social Security disability. I'm going to start the conversation in 2 quick slides about the New York State of Health. So if you are taking notes and you are going to be someone who is retiring before the age of 65, I urge you to write down the website for New York State of Health. And that is newyorkstateofhealth.ny.gov. And there's a phone number that's probably even more helpful, the 855-355-5777 number as well. So basically, this is where a person would go and they simply create a profile I'm a broker on the New York State of Health, and my clients come to me. We create a profile. We put all the information that's pertinent, including the income. People then see what's available as far as if there's a tax credit, or an advanced premium tax credit to help subsidize their health insurance. So that's a very, I didn't give you all the minutia, but that's the basics of what happens. And then once someone sees what they're eligible for, they can decide the level of coverage. This part you may relate to, where it's a bronze, silver, gold, or premium plan, and definitely takes analysis. So this is something that might take an hour or so with an individual. Here's just again, just a quick look at what what I was talking about with these levels, these platinums and such. You'll see on this chart, and again, do not want to see your head spinning at lunch, but different levels have different deductible amounts, different premiums that go with them. And this is why getting a nice analysis with a broker is helpful, because if you call the New York State of Health on its own, they may just say, which one do you want, and enter you in. So you can see some of the information there. Way too much information to try and go over today in the half hour we have. So now those first two slides were for an individual who is under the age of 65 when they retire and they need a gap coverage until Medicare. Now we're going to delve into more details about Medicare itself, the ABCs and Ds of it. So what is Medicare exactly? It is a federal health insurance program. It's for U.S. citizens and legal residents, individual health insurance plans, not family plans. So even if your spouse and you are both on Medicare, you will each have an individual plan, which may result in a different carrier, a different plan, because it's based on your needs. Medicare is not Medicaid. Medicaid, the term Medicaid and the term Medicare get confused very regularly. Medicaid is a state, you get it through the state or later the county, and is based on income. Medicare is not. Medicare is not Social Security, even though many people will pay their Part B premium in Medicare through the Social Security income month at a time. A person who is not on Medicare, receiving non-Social Security, receiving their benefits, will pay for Medicare on a quarterly basis. Their Part B premium will be paid on a quarterly basis. So, and it is not a family plan, as I've already touched upon. So who can get Medicare? I'm talking to one group of you right now. If you are turning 65 soon, you can get it. If you are older than 65, but you were still employed and had coverage that is creditable, which I'll refer to later, then you can get it after you retire from the work and leave the work coverage. If you are younger than 65 and a qualifying disability, and if you have end-stage renal disease, ESRD, or ALS, Lou Gehrig's disease, regardless of age, you could have Medicare. And here's where you can take notes here. I will ask you, if you are, write down medicare.gov, www.medicare.gov. All these slides have been stamped approval. These come from the resources from medicare.gov and from Social Security Administration website, which is www.ssa.gov. Okay, so you don't need to memorize this. There will not be a quiz. There will be no assessment later. But Part A, if you're going to leave this conversation with more knowledge, Part A refers to the hospital insurance side of Medicare. Part B is the medical side. So hospital, basically think of the building and those things that occur in that building. And think of B as the doctors and the specialists that you go to that are beyond that scope. When you have A and B, the term that is used often that is synonymous with having parts A and B is original Medicare. Now we're going to discuss a little bit of how they function. So if we look at the left-hand side where it's talking about the Part A hospital insurance, the original Medicare Part A, the premium for Part A says $0, and there is an asterisk. And What does that mean? If you have paid your taxes for 10 or more years, you will have what's called premium-free Part A. The asterisk is if you didn't have that work history, then you could have a premium as high as $518 per month. So that's a big difference. Most of us on this call will experience a premium-free Part A. The Part A also has a deductible. The deductible is $1,676. And let me pause, I'm sorry. These are all numbers that are good for 2025. Some of these numbers, can change and will likely change. There are projections and estimates, but this is 2025 numbers. So $1,676 refers to a benefit period. A benefit period is a 60-day period. So if you're beyond that, if you're in the hospital for beyond 60 days, you'll see that there's a per day charge from days 61 to 90, which is $419 per day. And if it's, God forbid, beyond 90 days, it's $838 per day up to a lifetime reserve limit. So one scenario I just do like to point out here, there's no limit to how many of these periods could occur. So one hypothetical situation is you are hospitalized for 5 days. You would pay the deductible of $1,676, and then the rest is covered. You go home, you stay healthy, and let's say 3 months later, you are hospitalized again. That is a new benefit period, resulting in the need to meet that deductible once again. So that is a vulnerability that people kind of see once they're made aware of in this coverage on its own. That's Part A. Part B, the medical side. Many people understand this one because it really touches their pocketbook. $185 per month is the 2025 standard premium for Part B. There's an asterisk. There's always an asterisk. So $185 per month, and you have Part B, unless your income falls in different ranges, which I will touch upon on the next slide. But let's go with the standard rate for now. There's a deductible on the Part B side, $257 for the whole year. So once you hit that deductible, then it goes to 20% of all costs plus any excess charges. And if you're like me, seeing a percentage makes me a little nervous because it's a percentage of what? What variable is that? And the biggest takeaway here is there's no limit right here on the left, no maximum out-of-pocket limit with just A and B. This table, I'll try and make it easy. There's no way to do this table and discuss it without heads or eyes starting to cross. So this is called an IRMA table, IRMAA, income related monthly adjusted amount. All right. So if your income as an individual is below 106,000, or if you're filing jointly under $212,000, then you would pay the $185 standard rate that we talked about on the previous slide. If your income goes above these levels, these are the related increases in what those new monthly numbers would be. So in general, congratulations, the better you do financially, your reward is that you get to pay a little bit more to the government. I don't know if you're happy about that. It's just a fact. So the other thing to pay attention to is for 2025, this would be based on your 2023 tax returns. So it's the 2 years prior. So as a planning individual, as a lot of us educators are, this is something you may now want to discuss with your financial advisor a couple of years before your retirement, so that perhaps you can figure out how to do things so that your income is actually below one of the next juncture points. And that could be helpful to you and save you quite a bit of money if that is what you're looking to do. So the original Medicare, here's some of the things that are not covered by the original Medicare, the parts A and the B. And you can see the list. I'll highlight a couple. The prescription drug coverage. A and B do not cover the drugs. There's an annual physical is not covered. A wellness visit one time every 12 months is. Dental, vision, and hearing. So if you wanted to have these areas covered, you would have to get separate standalone plans. Hearing aids, eyeglasses, contacts, and such are not covered. So obviously that leaves a lot of gaps in coverages that people are looking for and that they're accustomed to receiving when they are on employer coverage. So how can they get more? So put your seatbelts on because it's going to get fun now. Think of it as a pathway. Once you have part A and B, it's like a ticket to get into a show. Now, you must have A and B to consider the next two things that we're going to discuss. On the one hand, right here on the left-hand side is something that we're calling set and forget, and on the other is pay as you go. Set and forget is you enroll in original Medicare, that's A and B, and then you add one or both of these two things. The first thing is called a Medicare supplement, also referred to as a Medigap plan. Please be careful. The word supplement gets tied to all sorts of things and incorrectly. But a supplement or a Medigap plan basically covers all the out-of-pocket expenses that you might be used to paying with employer coverage, which is like the co-payments, the co-insurances, and such. And you would need, it says and or, but these plans don't have drug coverage. You would need to have some way to deal with your drug needs. And there's what they call a standalone Part D plan option. And this helps you cover your prescription drug costs. So this is one pathway, and we're going to get more details in a slide or two. And the other option is a pay-as-you-go method, where you enroll in original Medicare, and then you select what's called an Advantage plan. These Advantage plans also get the term Part C. So a Part C Advantage plan combines A and B into one plan. A lot of these plans will have the Part D embedded in it. So let me pause again. Part D is the only one that I think makes sense because it starts, the word drug starts with a D. So it actually makes sense that Part D is for drugs. Go figure that one. So here you go. You could have it embedded in the Advantage plan. And then down below here, you can see that it may offer additional benefits such as dental, vision, and hearing. In our experience, especially here in Monroe County where I live, it has become more likely that they include these just because these private companies want to be competitive with each other and have you select them. So it's actually favorable to the consumer in this case that more and more benefits are being put into these plans that are not required just to be competitive with each other. So now we talk about two pathways, supplement and advantage. Those are the two main ones. Here we're going to delve for 2 slides on the supplement side. So supplements, you're going to pay a monthly fee in addition to the Part B premium. So this is, remember, A and B had to already occur. So you're already paying a Part B premium, whatever that is. And now there's probably going to be a monthly fee with the supplement plan. And these are created by private plans that will cover the costs that are associated in original Medicare to some degree. So there are 10 of them that are standardized by the federal government, but they're offered by private insurance companies. So there's 10, and around the country, the same 10 exist. So regardless if you live in New York like we do, or if you live in California, if you get one of these plans, it's the same coverage. The difference could be that the monthly fee can range between, it says 50 to 350, but I know it's well above 350 now as well. So this number is higher. So it can fall in that range depending on the plan type and your home state and the company that's offering it. There's no drug coverage or dental, hearing, and vision benefits with these plans. So you'd have to solve for them separately again. So that could be from a totally different company, but you would have to find a solution on your own. There's no medical underwriting for up to 6 months after enrolling in Part B at age 65 or older. It's guaranteed renewable, meaning they cannot take it away from you once you have it. And the coverage is nationwide. And this is probably the main reason people do this is because that last part, there's no provider network. So any place that takes Medicare, you can go. This table, if your head wasn't spinning, this will do it. All I want you to do, you can see the top row, basic benefits, and it has A, B, D, G, K, and all those wonderful letters. Those are the plan letters that describe the different 10 plans we were talking about around the country. And it's wonderful that they use A, B, and D here. And we've already talked about what it stands for in the Medicare world. So these are not the same. It's a plan A, a plan B, a plan D, and such. We're going to focus on G for this conversation, just so we have one example to kind of look at. It is a common one that is used by the people that I run into, either a plan G or a plan N. And you could probably guess why. There's a lot of check marks. It means it covers these benefits over here. I'm going to highlight one. The big one that kind of stands out on the slide that we talked about at the beginning, Part A deductible is $1,676 per benefit period. Well, if you have a G plan and it's checkbox right here, it covers that for you. So you don't have to worry about that. And again, there's a whole list of things. These are available on the websites that I already referenced at the beginning. So feel free to delve into all the minutia there and send your questions my way if you have them. The alternative to the supplement is the Part C Advantage plans. And excuse me, and how these work in summary is that most of the plans do include prescription drugs. Many of them offer the routine dental, eye exams, eyeglasses, hearing tests, and aids and wellness programs. Like many of you probably have heard of something called Silver Sneakers or Silver and Fit or something to that effect, where it pays for the membership at a local gym. And what you do is you continue to pay that Part B premium. Like I said before, it's the ticket in the door, that $185 for the standard rate. Many of these plans could have a zero premium attached to them. So let me pause on that. A lot of people say, how is it possible a private company would offer a plan as zero premium? How does that work? Well, if we're all paying Part B premium to the government, that 185 at least, then that money goes to the government and it's sitting there. When you select a company that you are enrolling with on the private side, the government gets notified who that is, and some of that money gets allotted to that insurance company. So you don't have to worry about the insurance company going, out of business because of a zero premium. They're okay. You may have out-of-pocket copays and coinsurance when you use services. And it does say the word may, but I believe it's probably could be worded you will, because if you're not providing anything at the front end of it, you're going to be participating as you go. So remember that pay as you go phrase that I used before. As you go, you will pay. And one of the big highlights that people do like about this avenue is that there are typically annual out-of-pocket maximums with these plans. So there is a ceiling of what you're at risk for, even if you had your worst year possible. It might be a high number, but it's not as high as what it could be. So people do find that as a favorable part of the puzzle. Downside is you might need a referral depending on the kind of plan you have to go see a specialist. And another benefit is that it coordinates care support with a provider network. Part D, prescription drug coverage, we've kind of hinted on this already. It can either be a standalone plan, where you're just paying a company to provide drug coverage alone, or it could be embedded in an Advantage plan. So it's already in the Part C plan. What they cover are most common medications, specific brand name, and generic drugs according to the plan's formulary. The word formulary is important because that can vary by company and even from plan to plan within the same company. So we want to always investigate that in front. Vaccines that are not covered by Part B, you may have a monthly premium. The average premium is about $56 on a monthly basis, and that's due to probably go significantly up for 2026. You have a copay for each medication based on its tier. There's 4 or 5 tiers from lowest to highest. You may also have a deductible. And again, very likely that this year, even if a plan did not have one in 2025, that it will likely have one in 2026. And you may have to use a specific pharmacy to get different rates, like a preferred rate rather than a standard. And we've already talked about that bottom line. This also is subject to that IRMA table that we talked about for Part B, as in boy. The Part D is also subject. The way it works is if you're above that same 106 as an individual or 212 as a joint tax return, then you would add to the plan's premium. So if the premium cost, let's say, $10 a month for the plan, well, if you're in this category, you would have to add $13.70 per month because of the IRMA. And one of the last important pieces here is that there are 3 stages of drug coverage. So the deductible, most people understand because it's the first dollars go in, you are paying until the coverage begins. So many plans do it based on what tier drug. So once you meet that deductible, so in this case where they're using the example of $590, then you would go to what's called the initial coverage and pay co-insurance or co-payments. That's what we're kind of used to when we go to the pharmacy with employer coverage. So you're kind of used to this one. And then this year in 2025, the limit was $2,000 for the year. So if a person meets that $2,000 cap, they're done paying. So if they have a very expensive medicine in January or February and they hit that 2,000, they would pay a catastrophic coverage for the rest of the year, which is zero, which is actually one of the great changes that were made in by the government, believe it or not. And then there's the terminology used for the different tiers. As you go from tier 1 down to tier 5, the cost goes up. Now, because I know the time that we have, this is where making the decisions, there's lots of options of how to do it. You may benefit from having someone who has the knowledge of the plans and such to go through and decide which pathway is the optimal for you. Definitely want to consider what you're more comfortable with, whether it's having a higher copayment or a higher premium, excuse me, with less risk when you go, that sort of thing. There's additional considerations, whether you have special needs, whether you have Medicaid as well, because someone, believe it or not, can have both Medicare and Medicaid, and that results in the ability to enroll in a special plan that's made for people like you. If you have a special, unique chronic condition that has coverage available, you can have that. And if you live in a nursing home, there's special plans for them as well. Financial assistance, I help several clients who don't even know, even if they're not on Medicaid, that they do qualify for other programs that may help them with their costs overall, with prescriptions especially. And the time range. If you are someone, this is specifically to someone who's getting close to their 65th birthday, you are going to have 3 months before your birthday month, the birthday month, and then 3 months after. So that's 7 months total for the initial enrollment period. And you can get help. I'm glad to help anybody that needs to go through a Social Security website to figure out how to do that properly. Supplements have unique rules. After you enroll in Part B, you have that 6 months. I do not want the time to run out without getting to this. This is the key slide. If you are taking notes, please write down this one word, creditable. If you are considering working beyond the age of 65, you need to know this word. Your employer should be sending you a notification in advance of your 65th birthday stating that you have what's called creditable coverage. So that if you stayed with them beyond age 65 and you did not enroll in Medicare, you would then know that you would not be subject to a penalty later. So if you do not receive that notice, I urge every one of my clients, any prospective client, to go to their HR and to verify this information and get it in writing. Then, so if it's creditable, you have the option to delay. If it is not creditable, then you may on paper have the option to not enroll in Medicare, but you would then face a penalty later. So you definitely want to know the difference. I did that in very short time here because of the time frame we have here. So if you're not sure what I just said, please do not hesitate to reach out to me. But that is important. I'm going to slide by. Changing plans happens at least once a year once you're in Medicare. There's lots of other ways we can do it, special enrollment periods. There's the Medicare Advantage open enrollment in January through March. We've just begun this one. October 1st is when we first are able to talk to folks about their coverage. And we are getting bombarded, lots of changes, lots of volatility right now. But I help inform people so that they can relax and just figure out what's right for them in the future. So just don't be late. That's my final piece of advice. There's terminologies, but there's my contact info once again. And I know it was a very, quick meeting. I hope it was valuable to you. I appreciate you taking some time. And we're used to, as educators, knowing the answers to everything. It is okay not to know the answer to this. It is okay to seek guidance.
And Jim, we do have a few questions
Sure.
in the chat. I'm not
Sure.
sure if you're able to see them.
I can.
There's one from Jen.
Okay, I'm going to try and go to the top. Okay, I see Jim's email. Okay, so I think that was dealt with. Yeah, there you go. Who is the first one you see?
Jen.
There, okay. I thought in retirement we kept our coverage of some level as supplemental when we are 65 or older. Is that not the case? Does the district level insurance? That's district specific. And so there are some districts, at least for the teacher side, I'm not sure on the administrator side at all, on the teacher side, where they offer a Medicare group plan option. So it will do everything you need to do, but you would have to ask them. All right. So you'd want to know that in advance. And if you're not sure, what I've offered a lot of my clients, or even people that don't become my clients, but I just help them and give them the free analysis and say, hey, you're all set. I have them bring the summary of benefits of the plan that's being offered, and I just compare that to what I know about the individual marketplace. And there are some cases where there's no need to ever leave the district's plan, but I cannot say that as a flat thing. And then it says, will we have to enroll in Medicaid? So I just want to make sure I understand that. I hope Medicaid and Medicare are different. So I think you mean, will we have to enroll in Medicare and completely leave? That's what I think is meant by that question. So the answer is it depends. Some folks have to go get Part A and B. You'll need to go get Part A and B and take care of that with the government. The question is going to be, can you get the plan? Is there a group Medicare plan made available to you through the district, something they made with a carrier? Yes or no? If the answer is yes, then you can consider theirs, or you can consider an individual marketplace, which is what I help people with on the individual marketplace. If the answer is no, they don't have one, then you're going to have to figure out your own coverage. And again, that's where I could be a broker, can be helpful to you. I hope that answered the question.
Jim, there are a few more questions, but I just wanted to ask, how do people work with you? How does that relationship work if someone has a question?
Great. I'm sorry, I don't think I did mention that. So what I do is I'm a broker. I'm contracted with many of the largest carriers that we have in the area. I'm not an employee of theirs. I'm an independent broker. So I literally work for my client. So a client comes in or calls me or whatever. There's never a fee for any of our services. It's illegal in Medicare, but I wouldn't do it anyway. I think it's just about getting information. Once we look at your situation, we do a needs assessment, what doctors, what prescriptions, all that fun stuff, which takes time. We then analyze the options. And then sometimes there are obvious options and someone chooses to enroll in something that I represent, and I would then get compensated by the carrier. But there are times when I give all this advisement and then the result is the person should stay with the option, let's say the district offers, and then they stay with that, they feel better about it, and I would not get compensated in that situation. And I'm totally fine with either, because ultimately for my benefit, what happens is, and why Equitable has trusted me here, is because it's more important to me that the word of Empower and Jim Pashalidis is that we're trustworthy and we do what's right for the client, and we are getting, their reputation is already out there. So I don't know if that fully answered the question. But that's it. Someone would call me first or email me or scan or do whatever they want to do just to initiate. Because I do not cold call. You're not supposed to do that. If people are already doing that to you, don't answer the phone.
Thank you. Yeah, that was great. Another question. Upon retirement, I'm receiving 100% coverage from the district. Does this continue if I move out of state?
Question for your HR.
I had heard something about NYSHP insurance participants getting their Part B reimbursed by their employer.
Again, got to ask your own HR department. They're the ones that have all these arrangements, and it's not universal, to my knowledge, that I've ever seen that.
And someone does ask in the Q&A if you can share the presentation. Do you have if they email you, can you send it to them?
No, I believe you told me that you're going to actually have it on YouTube.
Yes, but if they wanted like the slides or something.
Well, technically, I should not be giving the slides out,
Okay,
but
so
I'm glad to run through this again. I can do one-on-ones. I do them I prefer one-on-ones actually. That way it's face to face or through a Zoom like this. I'm glad to do it again.
Perfect. And yeah, the recording will be available on our YouTube, and Jim will share it on his side as well.
I will. I appreciate it.
And there's one, can you speak to the role of how brokers work with school districts' plans for retirees? We do that. One last question.
Sure. I do not have a relationship with the school district, so I don't. So the short answer is I don't know, but I believe that they would have a team of people, or at least one person, but maybe a team of people who do what I do as far as licensed individuals that are assigned to the district. So they should have some.
All right. Thank you very much, Jim.